Hello everyone, this is Ola. Let's go ahead and continue with the hormones, functions, and disorders. And this time we will focus on the thyroid gland. You can see here that the thyroid gland hugs the trachea and it has two loops, right and left. And in the middle, there is an extension that we call the isthmus of the thyroid gland. Above the thyroid gland, we have the thyroid cartilage that we call also Adam's apple because this is prominent in some males. If you look to the thyroid gland under the microscope, you will see the thyroid follicles. Each follicle is lined with simple cuboidal epithelium, and we call those simple cuboidal epithelial cells follicular cells. Inside of each follicle, there is a fluid that we call colloid, and there are cells around the follicles that we call parafollicular cells or C cells. They produce a different hormone. The thyroid gland produces two different hormones, calcitonin and thyroxin. The calcitonin hormones is released by the parafollicular cells or the C cells that are located around the thyroid follicles. And it is released in case of elevated blood calcium level because its function is to decrease the blood calcium level to go back to normal. So in case of elevated blood calcium level, the thyroid gland C cells is going to be stimulated to produce calcitonin hormone. Calcitonin hormone stimulates the release of calcium from the blood to go and be stored in the bones. And as a result of moving calcium from the blood to be stored in the bone, the blood calcium level goes back down to normal. So this is a negative feedback mechanism. Here comes the calcitonin, and the calcitonin delivers the calcium from the blood to be stored in bone. So the blood calcium level decreases back to normal. And again, this is a negative feedback mechanism. The other hormone is the thyroxin hormone, which is the single greatest predictor of metabolism. So it's to increase our metabolic rate. It stimulates protein production. It promotes maturation and growth of the nervous system. So it's very essential in newborn babies to help maturation of their nervous system. And it also increases the cell's utilization of glucose. So it helps the cell to use glucose to produce ATP. It increases oxygen consumption by elevating the rates of aerobic respiration. Aerobic respiration happens in the mitochondria and oxygen is required. So thyroxine elevates the basal metabolic rate, which is your metabolism during basal condition. This means during rest without doing an effort. The stimuli for production of the thyroxine can be low thyroid hormone in the blood. So this is gonna, by negative feedback, stimulates the hypothalamus to release CRH, thyroid releasing hormone, also called whether pregnancy, high altitude, hypoglycemia. All of those are stimuli that need your metabolism to be increased. So the hypothalamus is going to be stimulated to release TRH. The hypothalamic thyroid releasing hormone stimulates the anterior pituitary to release TSH, thyroid stimulating hormone. That stimulates the thyroid gland to release thyroxin. The thyroxin increases the metabolism in all cells of the body, especially in the neurons. Also, it stimulates the process of glycogenolysis by the liver. You know that the liver stores glucose in the form of glycogen, but thyroxin stimulates the liver to change this glycogen back to glucose and release this glucose to be used in the circulation. We call this glycogenolysis. Also, it stimulates lipolysis, release of fatty acids to be released in the circulation, and then it can be used by the mitochondria for aerobic respiration to produce ATP. So people with hyperthyroidism lose weight easily because of this, because the thyroxin, which is at high level in their bodies, stimulates the process of lipolysis. Also, it increases respiratory rate, increases heart rate, and force of heart contraction. How does the thyroid follicle produces thyroxin? So here is a one thyroid follicle, and the fluid inside is colloid. The follicle is lined with simple cuboidal epithelium that we call follicular cells. For the follicle to produce thyroxin, it needs iodine from the blood. So what happens is that iodine enters from the blood inside the thyroid follicle. Then it's going to be oxidized by the peroxidase enzyme. So now we have oxidized iodine. The oxidized iodine joins the thyroglobulin found inside the follicles, and this can produce monoiodotyrosine when the thyroglobulin joins only one iodine, or it can lead to the production of diiodotyrosine when the thyroglobulin joins two iodines. If two of the diiodotyrosine join, we have T4, thyroxine hormone 4, that has 4 iodines. How about if only one monoiodotyrosine combines with diiodotyrosine? So we have now T3 that has 3 iodines. The thyroid gland produces both T3 and T4. Both are bound to thyroglobulin. So here we have the thyroglobulin that is bound to T3, and this is thyroglobulin with T4. The thyroglobulin with the thyroid hormones T4 and T3 go to the border of the cell, and then what exits the thyroid follicle are only the hormones T3 and T4. So under the effect of the TSH, thyroid stimulating hormone from the pituitary gland, the thyroglobulin is going to be endocytosed inside the follicle, and the thyroxin goes outside of the follicle by exocytosis. The T3 and T4 hormones cannot be free in the circulation because they are lipid soluble hormones. So they have to be carried with a protein carrier so that they can swim in the blood to their target organs. So they cannot move freely in the blood. They are rather carried by a protein carrier. The thyroid gland produces large amount of T4, the one that is formed by the combination of two diiodotyrosine, and it produces a small amount of T3, the one that is formed when diiodotyrosine joins monoiodotyrosine. But the active one is the T3 and T4 is not active. So once they enter their target cells, every T4 is going to be changed into the active form, which is T3. The TSH is the one that helps the dissociation of T3 and T4 from their thyroglobulin and their release out into the circulation to their protein carriers. What you can see now is a condition of hyperthyroidism. And sometimes if hyperthyroidism happens at the level of the thyroid gland, so primary hyperthyroidism, it can lead to bulging of the eyes that we call exophthalmos condition. And hyperthyroidism is associated with increased metabolic rate, weight loss due to consumption of the fat and glucose, hyperactivity, heat intolerance. Those patients cannot tolerate hot weather and they rather want to be in a cold weather. How about if there is low level of thyroid hormone, which is hypothyroidism? So the symptoms or signs are going to be opposite. So low metabolism. The person will feel very tired easily, so fatigue. They cannot tolerate cold. They don't have energy. And they gain weight easily as well. There is a condition that is called goiter, and this condition can happen before development of hypothyroidism. This condition, which is goiter, happens due to insufficient level of iodine in the blood. You know, iodine is needed. And as a result of that, the TSH from the pituitary gland trying to stimulate the growth of the thyroid gland to make thyroxin. So it stimulates the thyroid tissue to get bigger and bigger and bigger in an attempt to get the normal level of thyroxin into the circulation. Here is a condition of goiter, which is very large thyroid gland. And the reason here is low level of iodine. That's why nowadays the salt is iodized. All of the salt that we buy is fortified with iodine. There are 4 small glands at the posterior side of the thyroid gland. We call them parathyroid glands. Those 4 little glands, parathyroid glands, produce the parathormone hormone. And this hormone promotes increase in the blood calcium level by acting in the bones, getting the stored calcium from the bones into the circulation. So what happens when there is low level of calcium in the blood? The parathyroid glands, they are 4, release the PTH, parathormone hormone. This one stimulates the release of calcium from the bone into the circulation. And now calcium moves from the bone to the circulation so that the blood level of calcium goes up to normal. This hormone, parathormone, as well as calcitonin that comes from the C cells of the thyroid, both are not under the effect of the pituitary gland. They are controlled by the blood calcium level. So in case of elevated calcium level, what hormone is going to be released? Here, the C cells from the thyroid gland releases calcitonin because calcitonin is responsible for lowering the level of calcium in the blood. Calcitonin stimulates the release of calcium from the blood, and the calcium goes to be stored in bone. Since calcium moved from the blood to bone, now what happens is the blood calcium level goes to the normal level. On the other hand, if there is decrease in the blood calcium level, now the parathyroid glands are stimulated to release parathormone. The parathormone stimulates the bones to release calcium, and calcium goes to be released into the blood, into the circulation. So now calcium level increases to the normal level. So here we have the negative feedback by calcitonin, and parathormone controls the blood level of calcium. Let's do some review questions. What element is required for thyroxin production? Of course, it's iodine. Is thyroxin water soluble or lipid soluble? Remember, thyroxin is a lipid soluble, so it is water insoluble. That's why it needs a protein carrier to carry that in the blood. The blood is mostly water, and thyroxin is water insoluble. The thyroid gland produces large amounts of T4, which is not active, and small amount of the active T3. Both T3 and T4 are driven to the target cells by the protein carrier. And both T3 and T4 enter the target cell. Inside that, all of T4 is going to be changed to the active form, which is T. What is the single greatest predictor of metabolism? It's the level of thyroxin hormone. Thyroid hormone does what to oxygen consumption? Remember, it stimulates aerobic respiration, so it increases the consumption of oxygen. And inadequate secretion of thyroid hormones results in hypothyroidism, and in hypothyroidism there is weight gain, fatigue, and on the other hand, if there is excess thyroid hormone production, then this is hyperthyroidism, and here we have weight loss, hyperactivity, increased heart rate, and increased respiratory rate. Decrease of iodine in our diet would result in excessive secretion. The TSH from the pituitary increases to stimulate the thyroid gland tissue to grow and produce enough thyroxin. Low level of thyroid hormones as a result of thyroid gland issue. So this is a primary hypothyroidism. This will result, of course, into an increased level of TSH and TRH. So from the hypothalamus, we have the TSH, you have TRH, and from the thyroid gland, we have TSH. So TRH, and this comes from the hypothalamus. This is increases in response to low thyroid blood level, and this stimulates the increased level of TSH from the pituitary gland. Parathormone is the hormone that comes from the parathyroid glands, and its function is to increase blood calcium level. On the other hand, calcitonin decreases blood calcium level. So they are antagonistic hormones. If blood calcium level increases, the body will respond by releasing which one of them? So here, the blood calcium is higher than it should be, and we want to get this down to normal. And then calcitonin hormone is going to be released because this is the hormone that delivers the calcium from the blood to be stored in bone.